Welcome to the deep dive. Today, we're cutting through some noise to look at a really sensitive area. We're talking high-profile political comments, some, let's be frank, pretty out there pseudoscience, and how this all lands. The real impact on families, parents, educators dealing with autism support.
Yeah, our sources really focus on what happens when powerful figures, even the president, push claims that science just doesn't back up
Yeah.
about what causes autism. And we're not just looking at the science itself, but the fallout, why educators are genuinely worried. They expect these things to pop up in emotional conversations with parents. It just gives misinformation this extra punch.
It really poisons the well, doesn't it? Makes it harder for the people actually providing services. They're trying to build trust, reassure parents their child is valued, and then suddenly they have to debunk something said at the highest level.
Exactly. The educator ends up battling political noise instead of just, doing their job and providing support.
Okay, let's unpack the specific rhetoric we looked at. Our sources point to some very clear statements from President Trump and also from Robert F. Kennedy Jr. as HHS Secretary. What were the sort of core claims that got scientists pushing back so hard, so fast?
Well, they really hit two main areas, both pretty controversial. The first one, maybe newer to some folks, was blaming the rise in autism diagnoses on using acetaminophen, Tylenol during pregnancy. And the second, well, this one keeps coming back, unfortunately bringing up those long debunked ideas that childhood vaccines cause autism.
And those vaccine claims, we know they're not harmless. The sources are clear. They've already had a real impact, contributing to lower vaccination rates. That's a serious public health issue right there.
Absolutely, a
One.
huge issue.
Yeah.
And often the rhetoric wasn't data-driven, it was anecdotal, which, can sound really convincing if you're a parent who's worried.
Yeah.
Like one example that stood out was President Trump saying something like, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. Apparently talking about the Amish.
Wow. The implication is just so clear. Avoid this stuff, avoid the condition. It makes a really complex developmental thing sound like a simple choice.
It really does. It frames something needing societal support as like an individual mistake.
Yeah.
And it's interesting, this rhetoric was sometimes mixed with other announcements. Like there was talk of new money for data-driven research on autism, which sounds good, but then also authorizing experimental use of a drug, leucovorin, for certain symptoms.
It's a confusing mix, like some legit research funding alongside these really contested, maybe even pseudoscientific claims. That must be hard to parse even for people following closely.
It is confusing. And the sources mentioned autism researchers were, let's just say, quite skeptical about the leucovorin idea right off the bat. So the whole package felt muddled, blending real science with these unproven, politically charged theories.
Okay, let's shift gears a bit. Put the rhetoric aside for a moment and look at the actual data. When these claims about simple causes pop up, why does the scientific community react so strongly? What's the consensus?
Well, because scientists understand that claiming a simple cause, even if you mean well, can actually be harmful. Autism is complex. It affects communication, learning emotions, social skills. And the overwhelming consensus is that it comes from a combination of genetic factors and, crucially, environmental factors. Plural, not just one thing. Definitely not one pill you can buy over the counter.
Okay, so let's zoom in on that acetaminophen claim. Using Tylenol during pregnancy, that must have really hit parents hard. How quickly did medical groups respond to that specific idea? And how strong was the pushback?
Oh, it was fast, and it was definitive. Major groups like the American College of Obstetricians and Gynecologists, ACOG, they spoke up right away. And they weren't basing it on small studies. ACOG pointed to this really impressive 2024 study from Sweden. They looked at 2.5 million children.
2.5 million, that's a
Yeah.
massive data set. What was it about that study that made it so powerful against the Tylenol claim?
Well, the method was really smart. They looked at outcomes within sibling groups. So they could kind of control for all the other genetic and environmental things siblings tend to share. It helps isolate the effect of the acetaminophen itself. And what they found was nothing. No evidence of increased risk for autism or ADHD or intellectual disability linked to mom using acetaminophen during pregnancy.
That sounds pretty conclusive, but I seem to remember the FDA's statement being maybe a little more careful. Did they completely dismiss any link, or was there some nuance?
Yeah, the FDA added a really important layer. They did acknowledge that some earlier studies suggested a possible link and association. But, and this is the key part, they stated very clearly that a causal relationship hasn't been established. Cause and effect, that's different from just an association. And crucially, they reminded everyone that acetaminophen is the only approved over-the-counter drug for treating fever during pregnancy. And high fevers themselves carry risks for the baby, so avoiding it isn't risk-free either.
That context is vital. It's that risk-benefit thing that often gets lost in the headlines. Okay, so if these specific environmental causes keep getting debunked, what is driving this huge increase in diagnoses? The numbers are startling, right? From around 1 in 150 kids back in the early 2000s to, what is it now? 1 in 31.
Yeah, 1 in 31. It sounds terrifying, like a sudden epidemic. But the evidence points elsewhere. The sources really confirm that the main drivers are improved recognition and awareness. Doctors are using broader diagnostic criteria now, catching milder cases they might have missed before, and there's just way more early screening happening. So it's not necessarily more autism, it's that we're much better at seeing it across its whole spectrum.
Right, better detection, not necessarily a sudden surge in incidence.
Okay.
Let's talk about how this plays out in the real world then. Moving from the science debates to the actual impact, how does this kind of, careless talk from politicians become a real problem for families and schools?
Well, the most immediate thing is the stigma and the guilt. When powerful people point fingers at one single choice, taking a pill, getting a vaccine, it just, as the sources put it, heaps blame and guilt on parents who are already overwhelmed and need support. That makes it incredibly hard for educators or therapists to build that essential trust. They have to overcome this added layer of shame first.
And the language itself can be really damaging. I remember the sources mentioning groups like the ARC pointing this out, calling autism a crisis, an individual tragedy, something that destroys families.
Exactly. That kind of language is just devastating. It frames autism not as a neurodevelopmental difference that needs societal support and understanding, but as this awful preventable disaster that families are somehow responsible for and have to bear alone. It's dehumanizing.
And this fear, it's not just emotional, right? It
Right.
actually creates barriers to getting help, and that can worsen existing problems like racial disparities in diagnosis.
Oh, absolutely. There was that example in the sources last year when the government floated the idea of creating a big database on people with autism. They walked it back later, thankfully. But the immediate reaction from parents was fear. Fear about pursuing a diagnosis because who knows how that data might be used. And that hesitation is an equal opportunity. It can pile onto existing problems, like how Black boys with autism are sometimes misdiagnosed with things like emotional disturbance. They don't get the right support.
It's interesting, this pattern of blaming parents. It's not exactly new, is it? The sources mention sociologists drawing parallels to earlier theories.
That's right. Before the whole vaccine thing really took off, the common blame, believe it or not, was on the so-called refrigerator mothers. The idea that emotionally cold, distant mothers cause their children's autism. So these newer theories, blaming Tylenol or whatever, they might shift the specific thing parents feel guilty about, but it's still blame. It's just a new flavor of self-blame, often still targeted at mothers' choices during pregnancy or early childhood. We seem stuck in this cycle.
And here's where it connects directly to policy and money. That shift in blame, it has real consequences for funding, doesn't it? Professor Jessica Calarco made a really sharp point about this.
Yeah, she basically argued that if you frame autism as something easily preventable, just don't take that pill, don't get that shot, then it becomes really easy to see it as an individual responsibility.
Yeah.
And if it's an individual responsibility, why should society, why should the government feel a strong obligation to fund things like special education or support services? It weakens the collective will. It provides a kind of a subtle justification for cutting back. And the sources showed this wasn't just theoretical. The administration actually bypassed Congress to cut funding for some really key resources.
Really, what kind of things got cut? Things that would directly impact families and students.
Yes, absolutely. Things like parent resource centers. Those are often crucial for families trying to navigate the whole special ed system. Funding for training special education teachers got cut. Research into helping students transition to college or careers also cut. And efforts to deal with the nationwide shortage of school psychologists. These aren't minor things. They're fundamental supports. And framing autism as this individual failing makes those cuts seem, well, perhaps more palatable politically.
That link is so important. The rhetoric isn't just words. It shapes budgets. It shapes infrastructure. So what does all this mean for the special ed teachers, the ones who are actually interacting with these parents, trying to build trust while this national narrative is swirling around?
It puts them in an incredibly tough spot. Because they're often the most trusted figures for these families, they essentially become ambassadors of compassion. The sources really stress that their role isn't necessarily to win a scientific debate with a parent who's just heard something on the news. It's about leading with empathy, acknowledging the parent's fear, maybe their guilt or shame, all that baggage that comes from these high-profile accusations, and firmly reassuring them, Your child is valued here, and we will get them the support they need, regardless of all this noise.
That's a heavy lift. Trying to stabilize a family, grappling with this stuff while maybe simultaneously seeing the very resources they rely on get chipped away.
It's a huge challenge, no question.
So this deep dive really highlights that stark contrast, doesn't it? Between the loud, often simplistic political narrative focusing on single causes and the quieter, evidence-based reality of autism being complex, needing systemic support. We've seen how rhetoric focused on individual blame does more than just hurt parents' feelings. It can actually create a justification, maybe unintentionally, for weakening our public commitment to funding the services these kids need.
Exactly. And that leads us to the final thought we want to leave you with today, something to really chew on. If our public conversations, our political discourse, keep framing complex conditions like autism primarily as the result of individual parental choices, whether it's about vaccines or medications or something else, what does that constant focus on individual responsibility do over time to our collective willingness? Our willingness to consistently fund the state and federal resources needed to support the 1 in 31 kids diagnosed with autism in the U.S. Because that kind of broad societal support, it really depends on a shared sense of responsibility. And blame, well, blame is pretty good at breaking that consensus down. Something to think about.